I really was inspired by both of your stories, learning more tonight about both of them. And it is a true story of perseverance. You're two very, very strong women who are still driven to do all of the things that you always had dreamed of prior to having your injuries.
I was at track practice one day, and this is 7th grade, like right in the middle of middle school, April, and I was running like a warm-up lap. Like this was very early into practice. Like I hadn't done any heavy workouts, nothing yet. Like I literally just ran my one warm-up lap. My arm just like stopped working. I go over to call my mom, and I'm on the phone, and like I'm on the phone with my mom, and I'm looking at my coaches, and then like my knee buckles, and I just like fall on the floor. Like, but I'm still on the phone with my mom.
You know, you get this bad prognosis of, I don't know if you'll ever walk again. Maybe you will, maybe you won't, I'm not sure. You could take two ways with that, right? You could say, okay, I might never walk again. Or you can say like, okay, I'm not listening to you and I'm gonna be able to walk again. And if someone out there has been told that, I know so many people that were told you'll never move, you'll never walk. If they listen to them, they'll never walk again. But if they hear stories like mine and Gabby's, you know, you're not just inspiring them, but you're showing them that it's possible. And I think that just takes all this sadness away from everything that happened and empowers you instead. So you take a negative situation and you make it good.
Dude, we all have the best time ever to start a small business.
If I'm not gonna be 100% in, I'm not gonna do it.
Come on, man, just be yourself.
Yeah,
and just show up as yourself.
If you don't realize what I'm really about, I'm about freedom, family, and my country.
Welcome to Fireside America. Thank you so much for coming.
Thanks for having us.
Thank you.
I really was inspired by both of your stories, learning more tonight about both of them. And it is a true story of perseverance. And you're two very, very strong women who are still driven to do all of the things that you always had dreamed of prior to having your injuries. And what Fireside America started with was during COVID was people not being able to go and do the things that they wanted to do. And as a business owner, I'm my own boss. And I have the freedom to go do whatever I want, whatever that is. And I think that everybody should be able to do whatever it is that they want. That's real freedom. And it was about turning around and helping the next girl or guy in line by someone sharing their story in business. And over the last 4 years that it has evolved to a multitude of stories, right? Both of your stories really is turning around and helping the next guy or girl in line who is maybe a young, hold on, we got a plane coming right over. That's Johnny. Wave to Johnny. What's up, Johnny?
Hey, Johnny.
Both of your stories, for somebody who's going to watch on the other end, who may have been through something in the past year, the past month, maybe the past week, you're going to give someone strength and inspiration. So you're turning around now by sharing your story. So thank you for being here today. I really appreciate that.
Yes, I mean, it's always the goal, you know. You go through something that you don't ever want to go through, and you don't always necessarily want to talk about it, but when you do, I get this feeling, I don't know about you, I feel so much better about it, and that I get to help others, and it gives me solace over what happens.
You're getting the weight off your shoulders, being able to share it.
Yeah, I think, you know, me and Gabby have had the special privilege of getting more opportunities to share our stories than some, but when, you know, you speak and you're not just doing it, you know, for the other people that you're speaking to, and you know, I love being able to inspire people. It's amazing, but at the same time, like, you don't necessarily see yourself like that, but like that's not why you tell your story, for people to think you're an inspiration.
Mm-hmm.
Yeah.
You tell it because, you know, if my story and how I've been able to, you know, kind of take control over my own recovery, and Gabby, same thing, it just can show someone else too that, you know, you get this bad prognosis of, I don't know if you'll ever walk again. Maybe you will, maybe you won't, I'm not sure. You could take two ways with that, right? You could say, okay, I might never walk again. Or you can say like, okay, I'm not listening to you and I'm gonna be able to walk again. And if someone out there has been told that, I know so many people that were told you'll never move, you'll never walk. If they listen to them, they'll never walk again. But if they hear stories like mine and Gabby's, you know, you're not just inspiring them, but you're showing them that it's possible. And I think that just takes all this sadness away from everything that happened and empowers you instead. So you take a negative situation and you make it good.
And I love that. And again, I was somebody who didn't do well in school, and I had a mutual agreement with my high school junior year to leave, and most people statistically don't end up successful, right? So I shared that terrible time in my life and said, hey guys, I still got here in that light, and which is why I have you two here. Like, that is an inspiration. That is motivation, right? Because we could sit there and slip into the negative side of our brains and be like, I'm never going to walk again.
Yeah.
I'm never going to accomplish the goals I want to for my family. I'm never going to have the job I want, right? And you guys have both said, no, I'm not participating in that. And not only did you recover and walk through all of the strength at Children's Specialized Hospital, which you guys are great, you know, whether it's something that's real or not, you're like brand ambassadors, along with a bunch of other great families and children.
Yeah. It's definitely real. We can say that.
It is real.
I mean, we love speaking. I tell them all the time. Like, I like beg them to go to more things because it's a family there.
Yeah.
No matter what you do, you're part of this big family, and once you enter that family, you never leave. We love it.
Yeah.
I mean, me and Carly became friends because.
To say, you guys probably met through the foundation.
Oh yeah,
and
we definitely did, and I am thankful for it every day.
And it's also giving you guys, at least from my perspective, it's giving you really good public speaking skills. And you never...
I mean, I'll never forget it. It was one of my first events that I did. It was at a golf event in the summer. And I had to speak in front of quite a few people. And I texted Carly and I was like, how do I give a speech in front of like 300 people?
Word for word.
And I was like, and she was like, well, you kind of just like go up there and speak.
I was like, you can write it. Like,
thank God that she came to the event, because I was lost. But over time, it gets better, I will say.
You become more comfortable.
Yeah.
But all of these things, through all of these trials and tribulations that you guys are going through, you are building so many great life and career skills. Mm-hmm. Like, I look at both of you, I'm like, you're very impressive. Both of you speak very well. It took me a lot of time to just get to speak this, like this, right? I've never was somebody who was a wordsmith, and I don't think I am to this day. You both are excellent. So all of these things that you're talking about, I'm not just looking to give inspo or be a part of it. It's kind of therapy for myself, but you're also learning all these great skills. So that's awesome. So I want to start with you, Gabby. From Toms River, you have an awesome family. I love them.
Oh, they're one of a kind.
They're amazing. Your dad's trying to sell me a quad. I hope he gives me a good deal.
It's just sitting in our garage. No one uses the quad. I told.
I'm gonna ask him if I can lease it.
Right when they said they were gonna get it, I was like, I put $5 on it. No, he's never gonna use it. That he's never gonna use it. He used it twice. It just doesn't garage. It like looks good or something. Like, I think they think it just.
He's
like,
a dad. He wanted his son to ride a quad. I get it.
Now he wants like those new e-bikes or whatever they are. He wants like whip around on those things.
Yeah, those things are dangerous. They scare me.
On our way up here, we saw two guys that got hit by a car with it.
Yeah.
And my mom was like, "That's the reason you're not getting one."
My father-in-law said in New York City, people are getting hit and killed all the time, and it's just not even being talked about.
Yeah.
It's just like.
It's scary there to ride.
It's wild.
I would be terrified to ride.
Anyway, my ADD took us off track. But Toms River, great family, athlete.
Varsity athlete.
Varsity athlete. You're on the track one day, you're running. Take the story from there.
Yeah, so I was at track practice one day, and this is 7th grade, like right in the middle of middle school, April, and I was running like a warm-up lap. Like, this was very early in a practice. Like, I hadn't done any heavy workouts, nothing yet. Like, I literally just ran my one warm-up lap. And I was coming around to the end, and I had about like 400 meters left to run. And my arm just like stopped working. And I'm like looking at it, and I'm like why are you not working? And so like I run, and I'm like holding it as I go there. Like, I go back to like my coaches, and I told them, and they were like, oh, like maybe it's like fell asleep. Like, maybe a bug just bit you, and it's just
they
like
probably didn't want to scare you.
Yeah, they want to scare me. And they were like laughing about it too. They were like, I was like, yeah, it's not working. That's great. Yeah. And they were like, yeah, just like call your mom and make sure everything's okay. So I go over to call my mom, and I'm on the phone, and like I'm on the phone with my mom, and I'm looking at my coaches, and then like my knee buckles, and I just like fall on the floor. Like, but I'm still on the phone with my mom. Like, hey, like, mom, like I just fell on the floor. Like, my legs stopped working. And she was like, oh, maybe you have like a tick bite. Tick bite. Wish it was a tick bite.
Again, your mother. She doesn't want to
She
scare you.
doesn't scare. But now she's like starting to freak out. She's like, okay, I'm on my way. I'll be there in 5 minutes. She got there in 1 minute. And I'm just laying on the ground. And they call the ambulance. And they take me in the ambulance. And I'm in the ambulance. And my face stops working. So I was not symmetrical anymore. My face was droopy. And only my one side. Like I was speaking out of the right side of my mouth.
That's so crazy.
I know. So we get
What were you thinking in that moment?
I was thinking, I just had a track meet yesterday. I ran perfectly fine. What is happening? Like, this doesn't happen to me. I kept saying that in my house. Like, this doesn't happen to me. This doesn't happen to my family. This only happens to other people. You only read about these stories. Like, these don't happen to you. And when I got to the hospital,
What hospital did you go to?
Jersey Shore.
Jersey Shore.
So my mom immediately knew. She took me right to Jersey Shore. And I got there, and I get in the emergency room. There's a million people everywhere. My whole family is somehow already at the hospital. And so I'm like, oh, God, this is getting pretty serious. And, like, they start giving me these IVs. They're giving me CAT scans. Now I'm, like, completely sobbing because I thought, oh, it's going to wake back up. And coming from, like, a 3-4 sport athlete, you're like, oh, like, what do you mean I can't walk? Or I have to get strolled on a bed because I can't move. So they do my CAT scans, my MRIs, and I'm in the PICU. And so they admit me to the hospital. I'm in the PICU. And the doctor comes around, and I remember, like, rolling over. And, like, they showed, like, the scan of my brain, and it was just a big black spot. And I was like, what's that? And he was like, well, you had a brain bleed. And I was like, well, what is that? And he was like, they call it an AVM. So...
What does that stand for?
Arterial venous malformation. So
it's a type of aneurysm?
Yeah, it's a type of brain aneurysm. So basically, I had a bunch of, like, you know how you have the veins, capillaries, the arteries? So I had one artery that was feeding nothing, just a bad artery. So eventually, after so much, it just bursted. So it's just feeding blood to nothing now. So it's covering, like, my ability to move my entire left side. So, like, my motor skills, like, I literally couldn't move. Now, I got lucky because I still, like, could feel things. Most people don't. So they're doing all these tests. They're like touching my body. I'm like, why are you touching my body? Like, I don't like that. And like, can you feel? I'm like, yeah, I can feel. Just stop touching it now. But I can't move. So it's like weird to like feel but not be able to move it.
Did they hit you with that like meat beater thing? They're like, dang,
like smack your knee.
Did
And
you hear this? Like, yeah, dude, that hurts. Please stop.
Yeah, and I'm like, yeah, like stop. So I was in
Doesn't
the
it look like
hospital.
one of those things?
I use it when I on my patients.
Yeah.
Oh, and you're like, yeah, does your leg work? And I'm like,
the
yeah, it
reflex.
works.
It's
Don't
a
worry.
reflex.
Please don't do that again.
Please don't do that again. Yeah, it's like the most uncomfortable feeling. You're like, it's like when you hit your elbow
Yeah,
and you're
it's
like,
like dong.
like, oh God. So I'm in the hospital and I'm there for a while. And my dad's like, she'll be back in a week. Like, we're texting people like, she'll be back. No, I was not back in a week. So.
And how old were you at this time?
13.
13.
And I'm 16 now. So it didn't happen too long ago. But I'm in the hospital and I remember just like laying in bed. And I was talking to my mom one day and I'm like why? Like, when am I going to be able to get out of here? And like, when is this going to start working again? And I went through some pretty heavy procedures that like I was ups and downs. Like the doctor said, like that was normal. Like you're going to have ups and downs. Like, but like my sodium levels have dropped. Like, so there's another thing. I got to get
Any procedures you could share? Like what were they?
Yeah. So I had, I forget what it's called, but they went and clipped it first try. So
they cut into your skull?
So I had procedures before I had my actual brain surgery. So they have to like clip it, but like they don't go in yet. Mm-hmm. Like they put something up. Kinda.
Did they do a cath or a
I
coil,
don't know what it's
right?
called. Yeah, so they basically like kind of like tied it off. But
Johnny keeps doing laps for us tonight.
Yeah, what's he doing?
He must know you guys are on.
He's waving. He's waving.
He's waving.
Listening in.
He knows the famous people are here.
He's like, oh, he's podcasting right now. I gotta fly over to him.
Let's mess with him.
Yeah. So I have leading procedures to my brain surgery, and they like to say that I had a very textbook case. Everything went the way it should have. So
is that good or bad?
In that aspect, I was very lucky. It could have been 1,000 times worse, but everything went according to how it should. Every procedure was right. The only thing that was slightly off were my sodium levels. I didn't eat for a week straight. Then I had to get a feeding tube put in. But, like, myself, like, I didn't want that feeding tube in. So what did I do? Ripped it right out. But then they put it in again because I needed protein and I wasn't strong enough for the surgery yet. So I put it in, and I'm on week 2, I believe, and then I have my brain surgery. Weeks leading up to this, I felt terrible. And this is like kind of right after COVID, so no one could see me except like my immediate family.
Yeah, it's
so
horrible.
Not being able to see like my family and my friends to give me that motivation to, okay, you're gonna get out of here.
You'll be all right. Let's go.
Yeah, but instead I'm just sitting here watching TV every single day of my life when I should be out doing school.
Now, was that adding additional stress because
1,000%.
COVID itself? Were you getting pissed at the rules? What was?
I mean, so yeah, I was getting pissed because I couldn't see my friends, and that's like all I wanted to do.
If I can see my mom and dad, why can't I see my friends?
Because I was at track practice, and I'm 1,000 kids try out for track because they accept everyone on the team. So I'm at track practice, and all these kids are like watching me laying on the ground. My best friend's over here sobbing over me as she's holding my backpack. About 10 kids went home early that day. Because, it's like scary. You don't want to see your friend collapse on the ground and not know what's going on.
Trev, can we move this thing over? Because smoke's starting to attack them.
Yeah, just attacking me.
Yeah.
You're being troopers. It just spun your way.
It's scary. And I remember having my brain surgery. And, well, I don't remember it. But I had a 7-hour brain surgery. And they fixed it. They got everything out. And then we did a full MRI body scan. And they cured me. I'm good now. So then at that point, I had to go to Children's, and I had to do all my rehab, and from there, walked on out.
7-hour brain surgery. Now, did they have to, like, was it like a large chunk they took open? Like, how does that, brain surgery is scary as heck to me. Like,
yeah, so they shaved, like, a part of my head, which you couldn't tell. The guy, my neurosurgeon, Dr. Daniels, he was great. Like, he knew exactly, like, because I was, like, obviously I'm, like, in 7th grade. Like, I'm a girl. I'm worrying about my appearance.
Yeah.
I'm 13 years old. And so he shaved, like, only, like, he left a line of hair so that it could fall over. So no one would ever know.
Wow.
But I have a big S.
What a caring doc.
A big S. So if you were to feel my head now, like, I still feel like I'm like, hey, like, guys, like, feel my head in the summer.
It's like raised a little bit.
And there's like a dip in it. The click, I have a click in my, it's kind of cool now that I think about it, but like, then you weren't thinking about that.
That's so scary.
But no, yeah, I have a big S scar on my head. So they just went in. They basically just clipped it, got rid of all the blood, like sucked up all the blood and patched me back up.
Wow.
Yeah.
That is so scary but amazing, and again speaks to who you are and what you've continued to grow into. I'm going to switch over to you, Carly, because we were talking in the garage, and your story as well was just like, wow. So you originally had a vitamin B deficiency that you were unaware of. You and your family took a nice family vacation. Was it like your sophomore year of college?
I was in between. Like, it was over the summer break, so I was in between my freshman and sophomore year.
In between your freshman and sophomore year, you went to Iceland. Now I'll let you kind of take it from there.
Yeah. So I had, normal summer. I was working and felt great. I started packing to go back for sophomore year of college because when we got back from Iceland, I was going to be going back pretty quickly. So we got to Iceland and we're doing all sorts of fun things. We're, ATVing and we're going snowmobiling. Like, I was
living it up.
And we also, one of the main things that we did was went in and out of a few different, around Iceland, volcanic hot springs. I thought it was really cool. We went to the Blue Lagoon. I don't know if you've ever heard of it. And, I literally, it was all about the pictures, that was the most important part.
You got to do it for the gram.
Right.
I still do it for the gram.
Anything for the gram.
We're doing this for the gram.
Right. Exactly. So, like, that was my focus. And kind of like what Gabby said, going back to that is, that stuff doesn't happen to us,
Yeah.
So that was my big focus, right? Just keep that in mind as I tell the rest of the story. So everything's great, and we're continuing on with our week in Iceland, and we get home, and I was walking along, like just continuing thinking I was getting ready to go back to school, and I started walking feeling like I was like off balance and kind of a little swaying a little bit, where like every once in a while I would like kind of like grab onto like someone and be like, whoa, like, and I wondered if I had like an ear infection, because that can throw off your balance. And I just,
equilibrium.
You just start thinking, right? So I'm like, this is so weird. Like, I feel really off. Like, do I have an ear infection? Is something like, am I having like vertigo? Like, what is happening that I'm so off balance? Because I mean, I played tennis and soccer growing up. Like, I was also just like I was always involved. I was very active. You didn't see me sitting down. They used to joke, like, I like didn't have the attention span to sit and watch a movie because I wanted to like go run outside and play. Like, that was just always me. And so it threw me. I couldn't figure out what was going on. I was in a direct entry PA program, physician assistant program at the time, but still in the undergraduate portion. And so I'm trying to come up with it. Couldn't figure it out. I ended up at an urgent care. They were like, oh, we think you maybe have a sinus infection. Okay. So they gave me antibiotics, and I went on with my day. And then I started to feel worse, and I started getting nauseous, and I was like, I just thought I was sick. And meanwhile, it was my body trying to tell me like something is wrong. And so as I got sicker, I'm in bed more, right? I'm laying around, and I remember I went to bed and I just thought I was sick, and I thought I had, not like a stomach bug, but some weird thing, maybe from like, say, like I was reacting to antibiotics. I had no idea, but I went to bed, and I could have never expected that, like, middle of the night, I woke up and I didn't feel well. And I think I went to like get up, and all of a sudden I realized, like, oh my God, like I don't feel below my knees. Like I can't get out of bed. And like,
what are you thinking in that moment?
I don't even, to be honest with you, like, I don't even remember that exact moment.
It's like traumatic. You're like,
I think I
feel like, it's almost traumatic,
like,
where you don't remember.
Blacked out
a little bit. Like, I know what happened, what I did.
It's kind of a good thing, I feel like. I feel like that's like a defense mechanism maybe our brains have.
Actually, like, we talk about that in my house a lot, which is like, you get surgery and you were in pain after, but you don't remember the pain. You know you were in pain, but your body doesn't remember.
It's wild.
You remember that you were in pain, but you don't remember it. And I think that is definitely a defense mechanism that our bodies.
It's like it forgets.
Right.
Yeah.
So I don't remember exactly what my thoughts were in that. I mean, I remember a lot of other moments. That exact moment, I just knew I was like, I need to somehow get my parents like awake. And I mean, they were on the other side of the house. They weren't like not home, but I was like, I can't go run to their room and like tell them something's wrong. And at this point, I mean, I'm 19 years old, like independent and everything,
of course.
But in that moment, you just need your parents. I remember, I was telling you, so my dad's a physician, and we still have a house phone, which is like probably a foreign concept to everyone nowadays, but we still have our house phone, which honestly like saved me in this moment, because I grabbed my cell phone, which was next to me on my nightstand, and I called my house. And my parents know, we've like always kind of said, like, if our phone rings in the middle of the night, like
something's up.
Unless like, I mean, now like the phone doesn't typically like ring in the middle of the night if my dad's on call. He's an eye doctor, so it's there's usually like, unless it's the hospital, like
he's not doing like traumatic brain injury for an accident at 3 a.m.
He's not operating on Gabby in the middle of the night. So usually like it's like a worry when our phone rings in the middle of the night. So I was like, I remembered like, oh, this is a way I can get their attention. So I call them and I was like, you guys have to come to my room. I can't feel my legs. So they come like sprinting down the hallway, and my mom, I think it was my mom, I have like one of those like electric like heating pads that plug into the wall that I like love. And so it's right next to on my floor, next to my bed. And she was like, maybe like you just like, when you like get cold and you almost like lose like when you're cold in the snow and your feet go numb.
Yeah.
Right. Yeah. So she was like, let me, wrap this around your legs. Like maybe you're just cold. I was like, okay, like that's great. Let's try it. So she's wrapped it around my legs, and I'm, snippy 19-year-old who's like freaking out. And I'm like, oh my God, like, are you going to turn it on? And she's like, Carly, it's on full. Like, it's really hot. And that's when we knew we had to go to the hospital. So I ended up at St. Barnabas in Livingston.
What a scary moment for your parents.
Yeah. And we get there and you go to the ER and they start doing all these tests, and I was telling you earlier, it ended up being non-traumatic. So at this point, like, they have no idea what's going on. It's kind of just like, we don't know what's going on with you. You know, you start getting all these different opinions from all these different people, and that in itself is scary. Like, at that point, you just want a diagnosis because you're like, what is happening?
Yeah.
Like, fear of the unknown sets in, and it's like,
Crazy
if you
anxiety.
don't know what's wrong with me, how are you going to fix me? Because I can't live like this.
Yeah.
And I think that was one of the most scariest parts of this whole thing, is not knowing, you know, the professionals that are supposed to know all this not knowing. And then I'm like, okay, well, if you don't know, then how is anyone going to know? And so at that point, after being admitted, I was in acute care for a little over a week. And then I got transferred to children's specialized. And I mean, I got wheeled in there on a stretcher from an ambulance. Like, I was down bad.
And it wasn't just your legs at that point. You had lost.
So it was still below my knees at this point, because it was only within like a week. And once I was at Children's, that's when it's continued to progress. So then it progressed up to my waist, and so now what's still, you know, I have some tone in my left hand, but my sensation deficits stop below my waist. So I can feel like everything else. My core, I lost some core muscle. I had trouble, like, you know, I worked on my core to practice, you know, sitting up, and even just, you know, walking, you need all that core. And so they were like, let's just get you to Children's Specialized, and, you know, even while we're trying to figure out what's going on, let's at least get you stronger, because right now you're sitting in a hospital bed and you're not getting stronger. So, and at that point I hadn't progressed yet. So it's more like, okay, like, let's just, you know, you're out of this acute phase. Let's get you to rehab, and let's get you stronger, and we can still work on figuring out what's happening while you're starting your recovery.
Did you regress at all while you were at?
I didn't regress while I was at Children's. I got stronger, but my numbness spread. So
How long was it until they were able to give you a diagnosis?
I'm trying to think. I think it was like, I'm trying to think. This happened in August. I think it was like November by the time I officially started on like my
2 months of not knowing.
Yeah. So I got like IV steroids in the hospital, and I got like all of like antibiotic, like IV antibiotics. I was getting treatment. But
Was any of those things like helping?
I think the steroids probably helped. They decrease inflammation, right? And I think that they could have maybe slowed progression, but they weren't the cure. And I couldn't get the cure. They didn't do anything wrong. I couldn't get the cure because this is not a commonly seen thing, you know? Like, in one case, it's like, okay, if you look Gabby, right? She said, like, it was textbook presentation. So it was a horrible circumstance, but they know how to treat it. What was scary about this was that it was so non-textbook. I mean, it was like,
No one was putting together all those
people
pieces.
Don't know, right? People don't.
You didn't have lesions on your spine. Didn't have all these other issues.
No lesions on the spine. So when I didn't have an injury. Right. So you think of a spinal cord injury, and you think of a traumatic injury. There's so many types that are non-traumatic, but like the main ones people think of is like, did you fall? Did you, you know, get into a car accident? Did you have a diving accident? And those are one of the most common forms. But there's like these non-traumatic injuries that so many things can cause. An illness can cause, right? In my case, I had the B12 deficiency. And what they were able to figure out was, so my dad worked with this Dr. Sylvester, who is just like one of the smartest people I've ever met in my entire life. And he's actually an MS specialist. He runs the MS center. And we knew I didn't have MS at this point because I had brain and spinal scans, but he said, can you look, you know, you're one of the smartest doctors I know. Can you take a look at my daughter's, you know, file and look at her tests and just see if you can even point us in the right direction? He was like, of course I'll see her. So I saw him, and he took 40 tubes of blood work. Yeah, I thought I was going to die.
My blood could really draw 1 tube.
Yeah, I thought I was going to die. They told me I should go home and eat a burger. I did, because I didn't want to die. And
burger and a steak.
That was crazy, but and I had to go to 2 different places because it was like too much for one place to do.
Wow.
But so he ran tons of blood work, and thankfully, and I'm so thankful, because he had seen this before. He was able to connect the fact that I was in Iceland, which, you know, at the beginning you're like, what does Iceland have to do with all this? But I was in Iceland, and I was in and out of volcanic hot springs those are heated from the volcanoes. Volcanoes release nitric oxide into the air. What I learned through this, which Dr. Sylvester had seen, his case I'm pretty sure that he saw was from laughing gas, which is nitric oxide. When you have a B12 deficiency and you're exposed to nitric oxide, all of the symptoms that you can get from B12 deficiency, which are irreversible neurologic symptoms, come on like extremely rapidly. So it damages all the nerves in your spinal cord. Well, all of them, like it progresses, but they at the time described it to me almost as like a combination of like a transverse myelitis presentation with like a Guillain-Barré, which are just same thing, non-traumatic spinal cord injuries. So because he had seen it and he's just so smart, he was able to just put all these puzzle pieces together. And even now, when I tell most providers, they're like, "Oh my God, like I've never heard of this."
I would have never figured that out.
Yeah, and I mean, that's not to any fault of theirs.
No,
I mean,
it's just
such a freak thing.
Common.
That I have a lot of medical professionals
and
in my family.
And your father was on a mission, I'm sure. You know, he's a physician, so he's reaching out to.
And
As with any
so
parent.
many people. I mean, no one. Most people have not, unless you've seen it. Like what was actually crazy. One of my professors, when I tried to go back to school the first time, she was I think she was a PT, and she had a case from laughing gas on a little boy.
Wow.
So she knew, and I was like, I could not believe that she knew this. I was like in shock. No one had heard of this.
Your stories are just scary and inspiring. I want to talk a little bit more about what you guys had going on, but also where you're going in the future. Let's take a quick break and then we'll come back. Hopping back in, I wanted to just briefly, with the two of you, talk about your experience with Children's Specialized Hospital. If you could spend, 2 to 3 minutes each talking about that, and we'll start with you, Gab.
I could talk about them for hours. I was transferred from the hospital that I had my brain surgery at to Children's. They recommended Children's for rehab, and I spent about 5 weeks there. And I went.
That smoke's getting you. Sorry.
I went in completely paralyzed, on my entire left side. And they first asked me when I got there, they were like, "Well, what's your goal?" And I was like, "Well, to walk out of here." And at first I was like, "Well, no, I want to play soccer again. I'm gonna be running around." And then they kind of set it my realistic goal, and I was like, "Yeah, I just want to walk out of here. I just want to be able to get up by myself, and I just want to walk out of here." And I did it. I went through 5 weeks of occupational therapy, right? Occupational therapy, physical therapy, right? Therapy, speech therapy, and that was all of them. And just day by day. Oh my God, I'm actually
I know it's
yeah, it does. It makes you tear. I was trying to knock it down. I was hoping it would come towards me again. I got hammered the last 2 weeks. Maybe we'll have Trevor step in and help us out. Maybe
thanks,
smear it a little bit. Do they do burns at Children's Specialized Hospital?
Nope. Definitely not.
Yes, they do.
What about your experience, Carly?
So similar in terms of, I just remember when they were even discussing going to rehab in the first place, I was so nervous.
Oh, so against it. You never want to go there.
Yeah. I was like, I don't want to go there. I didn't even know what it was. I had never heard of it.
Yeah, it's that place you don't want to know of.
I had never heard of it. And they were like, "Oh yeah, you're going to go to rehab." And at first I'm only older people go to rehab. I'm so young. What do you mean I'm going to go to rehab? And they were like, "This is called Children's Specialized Hospital. It's all under 21. And trust me, this is the place you want to be." Okay, if you say so, but that doesn't mean you're not nervous.
Of course.
So, ambulance comes and they load you with the stretcher into the ambulance, and you arrive at this place, and everyone's so happy.
Yeah, it's
everyone's smiling, and you're like, what the heck? All these people are so happy, and they're going through something so hard. And at that point, I wasn't in as great of a mental space as these people seemed. And so I'm like, all right, well, here goes nothing. My parents were with me, obviously, and then you get a million evaluations. Everyone comes in, and it's you have even to fitting you for the proper wheelchair equipment, not get graphic, but to a chair to bring you into the shower. Like, it's these things that no one thinks of. Like,
all these new things that you're going to have to learn to do again.
And like I had PT, OT, everyone, the physicians doing head-to-toe exams, and it's definitely overwhelming, right? But you quickly learn that they know what they're doing, and they
need that data.
And they need that because, that's how they're going to get you to where you want to be. And I remember like my first nurse, her name was Maggie. She was awesome. And I remember she had pink eyelashes. I'll never forget. She was a breast cancer survivor.
Shout out to Maggie.
And she had pink eyelashes. And so I was like, oh, she's cool. And she came in and she was like, I think my mom told her outside how like I was super nervous to be there. And she came in and she was like, I just want to tell you that like we're here all night. Because I got there later in the day. She's like, we're here all night. And like you're always going to have someone here. Like you're not alone. Like, not that we're just assigned to you, whether we're assigned to you or not, like we got you. And that just immediately, I remember like I already like, even I was still nervous. I mean, I didn't know what to expect, but I automatically felt this like, okay, like I'm in a safe space.
I'm gonna get past this.
I'm gonna be okay. And the minute then you start your PT evals, and same thing. What's your goal? I want to get back to my life. I was still trying to do school. I mean, I was doing college work. They would print out my stuff for me, my labs, and I would try and do them in my bed. Like, I ended up not being able to keep up with that. But,
of course.
I mean, they were helping me. The nurses would come in and help. Like, and they said, what's your goal? I want to get back to school. I want to get back to my life. Help me get there. And, okay, we'll help you. You work hard, we'll help you. No problem. And they do. You're in the gym, and everyone's so happy. Like, you think of this place, and I actually tell this to a lot of, at all these events that me and Gabby are lucky enough to go to, I tell that to everyone. If you've never seen the hospital, you should go. Because
they have said that to me a bunch of times, Mark and Dr. Matt. And
I think you should.
It's like that stuff usually makes me so depressed. Like I'm a big baby.
And you see, that's what you would think. But you walk in there, and you're going to see sad things. They treat you.
Of course,
They treat, burn victims, spinal cord injury, brain injury, orthopedic injuries. They treat all that, and it's sad. It's kids. It's always hard. When
Anything
it's
with kids is tough.
Yeah.
Especially, you have kids of your own now. You're going to see it a whole different way. But you see everyone happy and getting better. Like, right? You say the same thing. Like, we always talk. And what was your first, when you walked into the gym and you saw everyone, what did they look like?
What do you mean?
What did you see on their faces?
Oh, they looked so driven. Everyone there, like, not that they wanted, everyone wants to leave, no one wants to be in a hospital.
Correct.
But everyone was so driven, and the therapists were driven for you, almost as.
One of them would,
It's almost like they're competitive to get you to your goal.
It's like, they fight with you. It's not like, they don't just say, like, okay, work hard. No.
Yeah,
like, they're, half the time, like, so I'm sure you did the same thing. It's a lot of like play therapy. So like we'd play games. Yeah. Like I would play cards.
Yeah, but they have you standing up.
But they have you standing. It's all secret therapy, and that is
therapy.
They're trying to distract your brain.
So you walk into this gym, and I remember I see people laughing, and I'm like,
what?
Why are they laughing?
Why are they standing?
Like, what is this place fun? Like, that's my first impression. I'm thinking, like, is this going to be like a miserable thing? And everyone's happy, and then you go to this rec room, and it's like they're playing music. All these people want to like get you out of your room. You're not sitting in a hospital room. You're going there, and you're hanging out with people. You're finding out, this person's story, and you're fighting together now. You're not fighting alone.
Yeah.
Now you got a teammate.
Different thing. Like I encourage you to go see it because everyone I think is nervous, to what am I going to see, and it can be sad in that aspect, but
everybody says the same thing.
It's so empowering to see these people, and like even for me now, like thinking back, and I look on their Instagram, right, and I see, and I'm like, wow, like these kids are amazing. They're smiling, and everyone's smiling and it's not fake.
Yeah.
You want to be there. You want to get better because you don't want to. I should rephrase that. It's not that you want to be in the hospital, but you want to be there because you're getting better.
Yeah.
That that
this
by
place
being
is
there,
gonna make me better. It's not. I should go somewhere else.
You get your life back, and that's.
Like towards the end of my stay, like when I first got there, I wanted nothing to do with the place. I just wanted to go home, hang out with my friends again. I have complete FOMO in middle school. I did not want to miss out on anything.
I felt
especially like those prime years. You don't want to miss out on anything, especially being in sports. So when I went there, and they moved me right from the hospital, so I went right there. And when you go there first, it's like, well, I don't, like, no, like, I want to go home, like, I don't want to do this. So your mind is already negative when you go there. But slowly over time, I remember, like, the last week I was there, I, like, didn't want to go home.
don't want to
I
leave.
did not want to go home.
It's your new family.
So much.
And it's also scary, you know, you're making so much progress.
Yeah,
Like,
that you're making so much progress that it's like, well, what happens when I get out and I'm, like, not
They're like, no, you got to
doing
go
this every
now.
day.
You
they're like,
can't stay
you're
here.
ready.
Yeah, they
and
just-
you're like, am I? Like, you
Yeah.
learn to just trust them with your whole life. And then
Yeah.
it's like, but that's what they do. Like, they
Special.
they're it's in the name, literally. And it
special.
is. It's so special. And like I told you, like, the family, like, it becomes a family. And between outpatient, you know, inpatient, everyone, like, you just develop these bonds with these people.
Now-
and it's real.
Now, the foundation is separate from the hospital. It's its own entity. And Mark Montanaro, which we referenced tonight, is chairman of the board now. What does Mark mean to you? Because he's a really special guy himself, and
I don't even
he's
know.
got so much love for the kids, and he just
I'm gonna
wants to continue to help. So take
I'm gonna
it.
tell you something. So, Mark is. I don't think I've ever met such a nice, kind-hearted guy.
Genuine, too.
like, genuine.
He is just
Yesterday, me and Carly were so nervous to come on this podcast, and we were like, "What do we do?" So our natural instinct kicked in.
Call
and
Mark.
We called Mark.
we patched him into
So we
our phone
patched him
call.
into
He's like,
our
you
phone
girls are
call.
setting me
And
up.
he was like, he literally, by the time the end of the phone call, me and Carly were like,
And he left his meeting to talk to us.
he left his meeting to talk. Like, that's just the kind of guy he is. Like,
He is.
he's in this probably more important business meeting than we'll
phone
ever
call.
be in
our
our entire
little phone
lives.
call too.
And he
That's
left
not
the
necessarily true.
meeting. He left the meeting, and he hopped right on and calmed us down
Didn't
and
even
told
take
us
a
it was gonna be
breath.
fine.
What were your biggest fears?
no, just in
We were
general,
just
like
it's just scary. I don't know.
Yeah.
Like, it's just like it's like anything. I feel
Big
like,
scary
you know?
Ryan.
yeah, exactly, exactly. How did you know?
And Mark
no.
probably told you he's a sweetheart.
Yeah,
He was like, "Oh, I love Ryan."
he's like, he told me I should come, but I'm gonna be at work,
Yeah,
and
he's
I was
"I'm
like,
gonna be at
oh,
work."
He's always so positive about everybody. You know, it's easy to get frustrated in business and relationships, and things get a little bit more complex as you get older, and you're dealing with business and stuff. And he just always has this way of, like, just positive.
Yeah.
And
Yeah, like I turned 16 like 2 weeks ago, and I invited Mark to my sweet 16, and I didn't think, like, maybe
He's busy. I don't know if he can
I don't
come.
know if he can come, but no, he came.
told
to
me he
my
came and he had a good time.
he
Yeah,
told me he
he-
was hanging out with your friends, and
he-
everyone was like, what are
oh
you talking
God.
about with them?
yeah. I was
You
like,
talk to anyone.
He came
can.
That guy.
to my
He
sweet
can.
16 out of his own time when he works already probably almost every day of the week, and he's coming to a 16-year-old's like sweet 16, and I just like
that means you
That's
impacted him
awesome.
too.
I think my most meaningful conversation, well, one of them, is with Mark was actually recently at the gala. We were just talking.
Yeah.
I think it was Buster from iHeart that posed the question of, what does it mean to see all these people supporting you that you've never met, right?
Yeah.
And I thought about it for a second, and then we also discussed it with Mark, and I said, like, I never knew when I was that little kid in that hospital how much donors and these people were supporting me. Like, I didn't know that. But then now I get to see it from a whole nother lens. You know, I'm seeing at Eat Clean Bro Gala, and I'm
Yeah.
sitting there and I'm watching all of these people that want to help kids, and
Todd and just
yeah,
everybody who's
the prom
involved.
tournament,
Yeah.
all these events. You know, I didn't know
Fortis
Todd,
group,
I
all of
didn't know
them.
Mark,
Yeah.
I didn't know Jamie,
Local
I didn't know
lenders, all
you,
of them.
I didn't know anyone, right? I was just there doing my thing, getting better.
Mm-hmm.
And I said to Mark, I said, it's just crazy how people that I will never cross paths with in life. Never. They supported my recovery. And he said, well, you didn't know us, but we knew you.
Mm-hmm.
And I was just like, whoa.
Yeah, he did. I remember. him
What a
saying
great
that.
line.
Yeah.
I was
like, oh.
I was like, oh, great.
Wow, that's
Because
wild.
someone's out there
Because
telling the
someone-
story of the kids.
Right. And someone's always ready to help. And that's Mark. He's always ready to help. And
is.
it's just, I hope to be able to, give back like that one day. I mean,
Yeah.
You will.
It's, you know, I was.
You already are doing this, sharing your story.
Yeah, and that's like kind of what I said to you earlier. It's like right now we can only do so much, right?
Yeah, there's
but
only-
by raising awareness of the fact that normal children with no other issues, right? We don't have a predisposed condition, right? She was at track practice. I was in a sorority and direct entry PA program, like thriving. We were literally thriving, and it happened in like this, literally at the snap of your fingers. No one thinks like that, and it can. I used
Can happen
to.
to anybody.
I spoke at helped run dance marathon at Montclair State, and my biggest thing I tried to convey to these college students was like, it happened to me, it can happen to you. Like, never be afraid to help, because I never thought it would happen to me. Gabby never thought it would happen to her. But now what are we going to do?
And I'll tell you from my perspective.
Help raise the awareness.
Yeah, from my perspective, and I've done a lot with kids' cancer and a ton of stuff outside of Children's Specialized Hospital. I've given money to just families that were clients or kids I grew up with. And I think like it's my way of like putting good juju into the universe to hope that never happens to me or my family. And I'm not saying it will do that, but a lot of people want to give. They want to do the right thing. And it's amazing to have people like Mark and the foundation that are out there leading the charge, telling stories like the two of you to get people to understand where their dollar's going. Because sometimes, you know, I've been involved in charities and I'm like, I don't know, like, is that guy's new car because of the money I gave him?
Yeah.
And I'm not saying it ever was or wasn't,
Yeah.
but, you know, sometimes if you don't know where the money's going, you know, it leaves you a little, you know, hesitant. And Children's Specialized Foundation, Mark, the whole team does an excellent job. Dave and Christina at Fortis, Jamie
Yeah, they're awesome.
and Kayla,
Kayla,
Todd,
Todd.
Frazier.
Everyone.
and-
You could just keep naming,
yeah, I mean,
right?
it's a group. Like, when I first saw it, I was like, I don't really want to do much with hospitals. I'll be very honest. I don't
Yeah.
like to affiliate with hospitals. They think differently than I do. And it was just the people who were associated with it. And then meeting the guys like Mark, hearing the stories of the both of you. And you guys are just doing an awesome job. You're doing an awesome job for the hospital too. Continue to be out there and helping them get help to the kids that are sitting in there tonight. I want to talk about your life moving forward though. Enough about the past. Enough about the past. Gabby, you're a 16-year-old, beautiful girl.
Thank you.
I'm sure you want to go to college and have some fun and
Yeah.
get some experiences. Where are you looking to go?
So my dream has always been to an Ivy League school, but I really have grown on the fact that my parents went to Villanova, so I do hope to go to Villanova.
That
I
is
graduate.
awesome. It's a great school.
Yes.
It's amazing.
What
And
is it?
what do you want to do? What do you want to do while at Villanova?
I want to study neuroscience.
Neuroscience. Wow. Now, do you think you ever would have wanted to study that prior to your injury?
No, I always wanted to go into criminal law. But after seeing, like after going through that, not that I feel obligated to do it, I just want to know more about it. Like I'm intrigued to know. Like I didn't know anything about brains, but now I feel like I could tell like about like the frontal lobe and like a normal conversation. But like I want to do more for that.
Yeah, that's amazing. How many people do you think go through some type of traumatic event like you guys did and then go into that study or that field?
I think not even just the people that experience it, but their families. I know a lot of siblings. You know, were you at Queenborough? I'm not
I
sure.
was not at this last gala this year.
Another great, amazing, strong girl. She was a patient, Ariana. She was another champion like Gabby. Her sister's in PT school. You know, when you witness this and you see how these things impact you, I don't think it just impacts you, it impacts your family.
Yeah.
And I think it changes the way you look at life, right?
Yeah, perspective shifts.
So yeah, I think it impacts you yourself. You know, everyone always asks me too, like, did it change you? And I'm like, well, it just furthered my passion, right? It's
And how are you doing in PA school?
Yeah.
Oh.
How you doing?
Yeah, well, finish Gabby.
We're
We're
on
going
you
back
now.
and forth. We're
We're going back and forth.
I know, I can't steal the thunder. She's
No, she was.
No thunder
gonna be
stolen.
I told you, we're going to jump in. We're going to
Yeah,
chat.
we're going back and forth.
This is a fireside chat.
But yeah, so PA school is going great. I finished my didactic, which is our coursework year, and then I just finished it's called like our immersion phase. So I've been in the nursing home long-term care facilities, and I've been in the urgent cares, and I start my first clinical rotation on Monday.
Where are you going?
A pediatric office. So
That's fun.
yeah, I'm very excited. I love
see all the
working with
babies.
kids. Yeah. So I'm really excited about that. And then what's really cool is, so I actually didn't know you were at Jersey Shore. I probably should have figured that out, but I don't know. We didn't.
We never really talk about.
So what's kind of cool, and I'm kind of a full circle moment for me right hearing her say that is, so we get to do 2 selective rotations. I was explaining to Gabby earlier, we have 9 rotations, and 7 of them are our core curriculum rotations.
You have to have those.
So it's like, you know, behavioral
Psych ward,
health and emergency med and pediatrics, right? So you have your core internal family, all of those set for you. Then you get selectives, and there's some that your school sets up that you can pick from, or if you know someone, you can set up your own. So Dr. McDonald, as I'm sure you know, I always spoke with him about, you know, how
nice
it'd be really
guy.
cool to come back. Oh yeah.
You're his dad,
Another
great guy
one of
too.
the very, very best there ever will be. And he always said to me, you know, it's only a matter of time until we get a PA. And I was like, ooh, maybe that'll be me. Like, you know, like,
Hey.
And so he said, you know, when you want to rotate, you let me know. When you're ready to go on your rotations, you let me know. And, you know, people say things, right? And you hope that can happen, but until it actually happens, who knows, right? So I tried not to get my hopes up, but of course my hopes were up
High,
because that would be like my dream. So I, you know, emailed Matt and I said, oh, we're getting ready to, you know, go on our clinicals and getting them set up. And he was like, okay, great.
Yeah, let me know when.
I had my rotation set, like, for me, right by him. That's it.
At Children's.
I got you. Yes. So I'm doing my one selective at Children's Specialized.
Wow.
And my other selective that I also set up, aside from like my ones that my school already had set up, is at Jersey Shore PICU.
That's
yeah,
awesome.
Which is
there.
like,
That's kind of crazy because when I was in the hospital, since I had such a textbook case, the doctor said the rotations came in and he evaluated me. And yeah,
Both my kids were in the NICU and the PICU at Jersey Shore.
Really?
Great hospital.
So yeah, so you know, but like even just hearing you say that, I'm just like, wow, like that's a full circle moment, right? Like,
But again, that's people coming together.
right,
And
and like I've known Gabby for a while now. We're very close, and I never knew she was. I should have, like I said, probably put 2 and 2 together because that's one of the best hospitals, especially for pediatrics. But like that's a full circle moment, right? She went from Jersey Shore to Children's, and that's one of the main reasons, you know.
You started there as a patient, and you're now going to come back.
Yeah, and like
as a PA.
I always say, like, I wish that when I went through everything I did, that I was in the direct entry program, right? So I was already on my path to becoming a PA. When this happened, I was like, oh my God, there's no way I'm gonna ever be able to be a PA again.
Yeah.
Like, there's literally no way.
The negative creeps in.
Oh yeah, and I mean, how can it not, right? I can't walk. I can't sit up well. Like, how am I gonna treat patients? Like, that was my thoughts. I can't go back to school. Like, how is my life gonna get on? And it was my mom who said to me, and she was like, "Don't ever say that again." Like,
Yeah.
you
Stop that.
Now she's a school psychologist, so I got like the psychology brain and then the medical brain, like, you know, double whammy.
Brain, yeah.
I always say I live with both sides, right, of medicine. So she's like, don't ever say that again. Like, you need to believe in yourself, and you know, you can do it. And I was like, okay. But then I listened and I believed in myself, and I thought back and I said, you know, how cool, when I was thinking of what field, and how cool would it be if I had someone besides my own mother who, you know, is always going to tell you, I mean, she was right, but she's going to want to replay that
Sometimes
again.
you want to hear
she's going
from
to want to
somebody
replay
else.
that part again
Yeah.
and again, me saying she's right. But, you know, she's going to say what I want to hear, right? She's my mom. She's comforting me. But if I had someone too that was gone through something so traumatic. Even
And you could speak from your experience.
And they were treating me, and I can see like, oh, like they're not kidding. Like I really can do this. I think that
as you were talking, not to cut you off, as you were talking, that's all I was thinking the whole entire time is how powerful is that for this
in
person
any
that you
field,
both walk
right?
in
It's
there
like-
very down, very afraid, right? Very annoyed. And now you have this person that had exactly or close to
right, and like
the injuries you
maybe
did.
not even like me. We always joke, right? Like we have two like completely different injuries, but we have a lot of the same thing.
We
Like
do.
both our hands get tight, right? Like
Yeah.
we joke, and like we can relate to each other, right? But we
Correct.
had totally different circumstances, totally different.
And now you're going in as the doc.
And now I can go in and I can be like, look, and obviously, you know, you separate, like, I'm going to be more of the provider, right? I'm not, I can't be their, you know, best friend, but I'm going to help them. I'm going to help them get better. And they can look to me and be like, wow, like, she did it, I can too. And I wish I had that, and not to say that the providers I had, I mean, I always say, like, I hope to be able to, like, provide that care that I was given. Like, they were top-notch, excellent providers.
But now you see it as one step further. You're like,
Right, and I think
they gave you a building block, and now you're looking to step that up. That's nothing wrong with that.
And I just think back, like if I had that, I think it just would have been a game changer in a way. I wouldn't have been as doubtful as being able to, is this even possible?
Yeah, it's hard to believe when you're, you know, not feeling your limbs.
And I hope that one day I'll be that for someone. And I think, you know, even just at a rotation there, I'll be there 5 weeks, right? You know how many people I'll meet in 5 weeks there, and how many stories I'll learn?
I'm telling you right now that you will be.
And it's like, it's just, I'm so excited to just meet these patients and, you know,
work with the staff.
And see, right, and work with these people that gave me this opportunity. I wouldn't be able to do this. I mean,
That's awesome.
You know, I do my continuous therapy. Obviously, I aged out of the hospital system, but I do my therapy at Kessler, right? And I go in there, and even there, like, you know, I talk to these patients, and you perform bonds with these people just on another level that if you haven't gone through, like me and Gabby became such fast friends.
I know, yeah.
It was like we've known each other forever. But when you go through something like this,
you have something to relate on that other people
can't.
can't.
On a different level. No matter the age, no matter the circumstance, you just, right? Like, how many people have you met that, like, you've just been able to connect with?
A ton. I mean, even my like physical therapist and my occupational therapist, like when I'm gone for a week, they're like texting me. They're like, wait, like where are you? Like we miss you. Like we brought in cookies for you this week. Like where are you? And
what type of cookies?
Crumble cookies.
Ooh.
Yeah, all right. Depending on
they're
the week.
bribing her to come still.
It depends on the week. But it's like you form like these other bonds with people that you never thought you would have formed.
How, just in general, and obviously you're going to be one and you want to work in the medical space as well when it comes to the brains, like just nurses, doctors, you know, physical therapists, all these people are really special individuals. Like I definitely could never do it. Ever.
Yeah, but I couldn't do finance, so.
My bedside manner would be horrible. Like, shut up and just, we're going to get you done and fixed and just stop. You know?
I mean, they have a
Special.
different mindset for you. It's like when
different heart.
I'll never forget. I was like, it was like maybe like a year ago, and I was at PT, and I've had like the same PT, like you kind of work with the same people as you go. And this guy, Ryan, he was my therapist. And I'll never forget, I was like on the treadmill, like doing the off street, and I was like, yeah, like I'm not, like I don't want to run today. And he was like, you don't want to? I didn't ask you if you wanted to. Like you're running today.
Yeah.
And they push you, and then you get, and like then you're running, and you're like, oh wait, like this isn't so bad. Like, and you're running, and they push you to be the better version of yourself. And I think that's what I like most about my physical therapist.
Now, what jobs are you working now? Like, are you staying busy or just focused on school?
I mean, right now, I mean, I'm like full.
Well, you guys
school.
have full-time jobs as ambassadors for Children's Specialized Hospital. This is exhausting.
Yeah, so we
Podcasts, galas,
so we
golf
actually
events.
just got a new role, which is really exciting.
Are you allowed to talk about it?
Yeah.
Gabby, tell us.
So we now mentor other prospective ambassador families. So we had, what was it called? Media Day with like 7 other families, I believe it was. And so me and Carly kind of just like guide them and lead them, and like we show them how to do like the B-rolls that we usually do, which are like the interviews about like your story, and the families tell their story, or like the pictures that we send to like donors, and we all took pictures together and we gave them like their gifts, and like
and
you obviously know how impactful that is.
And we got to share our stories with them, right? So that's another thing. And
but also like guide them too. Like when I first became an ambassador, I was like, but what? Like I almost like didn't know like what it was. But
It's
now
a big
that like
role.
I do it, like
Role.
I understand like with the families, like they call you up and they're like, oh, okay, like gonna come in, like help you, and they don't like you don't know what you're getting into.
It's scary.
So,
Again, you go back to the
there,
trust
right?
factor of like, you two are sitting here, and I'm going, okay, the checks I wrote to Children's Specialized Hospital now, like, I feel much better about. Not that I didn't feel good about it already, but you are a walking success
we
story
joke that
for
we're
them.
literally walking examples
literally
of how
walking.
important supporting children's health is.
Yeah, no pun intended.
Like literally no pun intended. We
Yeah.
are walking examples, and that's kind of like what we always like when we are at these events. We're like, all right, well, here's your walking,
Here's
walking,
your
talking.
walking.
I mean everything. Like
Yeah, and here's our story when we weren't walking.
Yeah.
right,
Well,
right.
You two are very special, and you're going anywhere that you believe you want to go.
Thank you.
And you've done amazing things for the hospital. I'm sure you're going to continue to. Mark, Dr. Matt, the whole team, they are good people.
Yeah, Alyssa. I mean, they're all just.
I asked 2 questions to all of our guests, and it's usually business focused. And as we transition this podcast into all stories of perseverance and success, I'm kind of switching these up. So
Okay.
the first question,
Challenge.
the first question I want to ask you, and I'll give you each like a minute to answer, is who was the most impactful person? And I know it's hard to do. But who was the most impactful person when you were at your lowest point during your injuries?
Oh my gosh.
Like one person,
I'll give you 2.
One person.
like maybe a few.
We
There's
can't get out of
like,
control.
It's really hard.
I rattle all 5.
Does family count as one?
Yeah, you can do family. Mom and dad obviously are a given.
Mine, I have 2. My first one was my soccer coach, my travel soccer coach.
What's his name?
His
Give him
name-
some love.
Coach Jeff,
Jeff.
Jeffrey Karlovich. And I was at like such a low point when this happened because I was like, I'm going to get emotional like talking about this. I was like, I'm this top soccer, like I'm the captain of my soccer team. Like, why is this happening to me? And he like came in, he like sent me gifts. He still included me. They would be at tournaments and he would FaceTime me. And he's like, oh, well, here's another trophy you can add to your collection. Like, we won this for you. And that, like, boosted my confidence. And, like, it made me want to work hard to get back out there. And, like, still to this day, like, when I still, like, it's obviously hard getting back to sports, but I still, like, practice with them. And, even like, we have tryouts, and he's not going to cut me. And it continuously makes me want to get better because he believes in me. So I believe in myself.
Mm-hmm.
And I think that pushed me, even when I was in the hospital, like, he sent me this gigantic teddy bear. And he sent a note and was like, if you need a hug sometime, always here. And that pushed me even farther. And even, like, to this day, I'll never forget, last weekend I had a huge tournament. And even though I'm not as good as I used to be at soccer, he still acts like nothing changed. He still makes me work as hard. He treats me as if nothing ever happened. He still is starting me on the field. He lets me be a captain, and it just, I don't know, it just pushes me in a different way.
He's a special coach.
It just pushes me in a different way than my parents ever did. Now, like, I have so much support from them. I love them. But he pushed me in a different way that no one else has ever pushed me in. And
Gives me chills. Some of the
me
best coaches
too.
out there really know how to read every individual on the team and figure out how to get the most out of them. And obviously Coach Jeff has done that for you because he's looking at this long term. He's not just thinking about your high school soccer career, which has been awesome. He's also thinking about what you're going to go do in life. You know when people get up there in the NFL or baseball or in their big job and they give their retirement speech and they thank their high school coach? You're at such a crucial time in your life, and obviously he's made a great impact.
And I think he, besides the fact that you were a good soccer player, you're an even better person. And I think he sees that clearly.
He sees that, yeah.
And, like, there's more to you than soccer. And, like, I watched...
He wants you to know that.
I actually went to one of
she
Gabby's
came to one of
games.
my soccer games on.
I surprised her at one of her games.
Yeah.
And she says she's not... I don't know what she was before. But she's still pretty damn good at soccer.
I was going to say that. Like, don't
So,
say you're not good.
Mind you, like, she can say whatever she wants, but I witnessed it, and she's running. You would never ever know that anything happened to this girl right here.
It's amazing. And
when
again,
she's on that field.
And that's a coach believing in you and pushing you, and just like the therapist is, just like everybody else is.
I think it's because he's just been there for all of it. Like, I've only ever been on one team, and right from the beginning, he's always trusted me. When we had tryouts when I was in first grade, I had a broken leg, casted all the way up to my leg. And it only took one coach to tell him that, like, I was driven, I played, like, I was good at soccer. And he trusted me right from the beginning. And I was still in a boot. And I'll never forget that day because we had like a meeting together. And he brought me in. He didn't disclude me because I had a broken leg and didn't try out for the team. Like, most coaches are like, oh, you didn't try it. Like, you're on the, like, B team, whatever. No. Like, he was like, he took the recommendation from another coach and took me right in as one of his own. And I feel like we've kind of created, like, a special bond now. And even, like, growing up now, like, he's seen me before, he's seen me during, and he's seen me present, he's seen me after, and he's going to see me the rest of my life now.
100%.
So I just...
Special people. Shout out to Coach Jeff. Who's your second?
My second is my best friend, Lauren. She was the girl that I was talking that was standing over me.
Holding your book bag.
Yeah. She was holding my backpack, and just to see her tears come down, it's like she went through it with me. And, like, I'm going to get emotional. I'll never forget, we look back to this day now, and she has pictures from every single day of the month of her just, like, sending me something, like, just a word, just a sentence. She texted me every single day when I was in the hospital, and she was, like, one of the lucky ones. Since it was during COVID, I didn't get to see many of my friends, so she lied to get in and said that she was, like, 18 years old. She wore her face
That's
mask.
a true
She
best
wore her
friend.
hood up.
That's a true best
and
friend.
when she walked in that day, she had this big basket and she had this big card, and she just went through it with me, and I could feel it. Like, like,
you know
when
who has
you
your
go
back.
through something like that, like, you feel so alone, but, like, I felt like she was going through it too. Like, I almost thought something was wrong with her. Like, she was going through it so much. Like, I would sit here, watch a movie, and, like, she'd feed me food because I couldn't do it with my left arm. Or I'll never forget this part. I was in children's, and there was a party going on at, like, one of our friends' house, like a big, like, end of the school year party. Like, it was getting summer, like, we go to the beach, we live by the shore. And I texted her, and I was like, oh, like, she asked me how my therapy was for the day, and I was like, it was really hard. Like, I don't know. I just, like, miss everyone. Like, and it's summer, so it's like Memorial Day weekend, I believe it was.
FOMO.
It was
in the worst way.
FOMO, and
Yeah.
she was like, oh, okay, I'll see you in an hour. I was like, what? And she's like, I'm gonna leave the party. I'm gonna come see you. And before I knew it, she walked in with, like, cookies and, like, everything that I loved, and stayed there until, like, they kicked her out. Like, literally until I had my pills, and they were like, okay, like, you gotta go. And she just never left my side through all of it. And even after, like, people don't realize, like, when you're in the hospital, like, you go through it, right? But when you get out, it's almost 10 times worse. Because now it's like you go back to real life, but you're not the same. Like, your life changes. Like, I had to go to therapy 5 days a week. I was challenged mentally, and, like, not being able to go to, like, play soccer. Like, I wasn't back fully, not doing track. Or, like, my parents just, like, like, my parents just, like, worrying about me.
You were kept so busy at the hospital.
Yeah, and, like, you don't
and
realize.
you're surrounded by everyone that's like you.
And, like, a lot of people, like, when I got out of the hospital, like, didn't understand fully. They're like, people, like, once you have your brain surgery, like, oh, you're fixed, like, you're back.
You're also 14 years old. There's not a lot of perspective in most 14-year-olds.
But she, like, got it. And, like, if I needed help, like, opening a jar of pickles, like, she's holding the thing and she's twisting
What
it
type
over
of
me.
pickles?
Oh, God, I don't even know. But
Garlic, spicy?
Just an example, but, like, it's just, like, those small things. Or, like, I didn't want to go to the beach because I couldn't swim yet. So she was in the backyard, like, in the pool with me, like, helping me swim.
That's going to be your best friend for life.
Yes.
And one day you might have to turn around and help her with something hard in her life. And it may not be something like that. It may be something else. And I know you're going to be there for her. And those are special people, and hold on to them. You know, as I've gotten older, you know, the kids I grew up with, we just, you know, we're guys. We get busy and we get wives and kids, and you're chasing dreams. And, you know, some of those childhood best friends are special people, and you have those things forever. But a lot of times the girls, you guys, you know, stay friends with that best friend forever, and You two definitely won't ever. Carly, come on,
All
you got to
right.
give me
I
your
know,
people here. You
She
can't
gave
give me
time
10.
to think. I feel like a little bit different. Like, I feel like mine, I have to like group people, right? So like, I don't know, like I was older. I was 19. So I was at a different kind of bit of my life. So besides like my family, I mean, that goes without saying. Like they're
course,
like,
your mom and dad were
they
there.
carried me
Yeah.
through that. My mom hurt her back because she was trying to carry me so much. I mean, like my dad literally, and I said this to them the other day, like I was at my white coats ceremony, like a week and a half, 2 weeks ago at this point. And, you know, my parents decided it would be a great idea to go around with, we like had a bunch of my friends came and to go around and say something that was, you know, special about me, which I don't do well with. And then I went around and I, you know, said everything about each one of them. And when I got to my parents, I like couldn't come up with words. Like it just goes, I don't know how to put it into words, everything that they do and they done and continue. Like without my parents, like I would not have gotten through any of that. So that I think kind of goes without saying. So they're not in my two.
Mom and dad, you're not in.
they're above it. And my siblings. I mean, my siblings, like
What's your sibling's name?
Ellie and Noah. And my sister was a senior in high school and my brother was a freshman. My parents were at the hospital with me on their first day of school. Like they had to sacrifice a lot, but they didn't miss being there for me.
So the whole
either.
family goes through it.
So I think they're not in this group, they're above it.
All right.
And so my first one is my therapist that I started at Children's Specialized Outpatient, but because of my age, it was a little bit harder. So I stayed with doing pool therapy there, and then I got transferred. I've been at the Spinal Cord gym in Kessler. My PTs and my OTs there, like they were at my graduation party from college. Like they celebrate me as much as any family member would. There are days like I would go to therapy and I would be like just not unwell. Like I just would not be in the mind space for therapy, right? And not want to push myself. But like Gabby said, like that was never an option. Like they've carried me through these past 6 years.
Again, what we were saying before, they're just, these types of people are so special.
Mm-hmm.
They're just so special. Like I can't even put it into words. Like, so Maureen has been my PT with me for 6.5 years now. And, I mean, I called her on the phone 2 days ago to tell her about something exciting that happened. Right. And Alicia and even another, Alyssa is also, those are like Alicia was my primary OT. And then Alyssa's also, helped me. And I did Alyssa's baby's first birthday pictures. You know, they become your family and they care so deeply about you that like, you're not going to therapy. You're going, like, I love therapy. Like they have to kick me out literally and be like, okay, it's time to be discharged. You need a break. And I'm
Go.
like, no, I love it. I love going. And who loves to go work? Like it, what
part of your life
person
now.
says that, right?
It's part of your life.
And like they're just so special, and I truly tell them, like I thought about on my white coat day, right? And I'm texting them the pictures, and I'm just like, and I mean it, like I would not, and they say I wouldn't be here without them, without, you know, all my therapists at Children's Specialized, that like they all play such a big role in my life, but like obviously I've worked with, you know,
I know it's just hard. I
Maureen
gave you just 2 people,
that's why
but
I'm grouping them.
what's your next group?
My next group
Before you
is
freeze here.
my next group is my what I call my forever friends. That's a term that I feel like a lot of people don't necessarily have at such a young age, but like your friend, forever friend. Like when you go through something so traumatic, you learn how to kind of decide who's a real friend, right? Who's there for you in your hardest times. And I have people from all different aspects of my life that just never left my side. My best friend Monica, she came and did therapy with me in the therapy gym, right? She came to Kessler and did therapy with me. She drove me to appointments. She was the first one to watch me when my parents went on their first overnight after I had this happen to me. I had my 2 best friends from PA school, from the direct entry program, who made time in their busy. I mean, I see it firsthand now. I'm in PA school and you have no time. They made time to come see me and surprise me. And I have like, you know, my friends from growing up, you know, there's too many to name, but like that supported me. But, you know, you have these
Good
people
friends.
and then I have my grandparents who like cry at the thought of me even like getting a white coat for days and call me there's just so many people like I don't even know, but that are there for you in these times. And it's like they're your forever people. Like these are my friends that I'll have forever. They will be there for me when I'm at my lowest of lows, and they'll celebrate with me when I'm at my highest of highs. Her friend was there for her when she was on the ground crying over her, right? And now, I mean, I don't know if she plays soccer. Does she play soccer?
Yeah.
They're playing soccer together and they're celebrating a Sweet
Special.
16 together. And
you're going to
it's
do
just a
things with your
different
friends and
friendship.
family. Yeah.
They all took off to come to my white coat ceremony. Like,
So
it's special.
I know you guys both can name a lot more than two people, and the people that, you know, I was just curious, is there like, you know, somebody like, I got it out of Gabby, it was like that coach, right? That coach was, you know, but again, we don't have to answer it that way. Let's listen.
So, I have a person, but I
All
never
right.
actually met her. Is that fair? I've never actually
If
met
this is
her,
the
but it's
person
one of
for
my
you, yeah.
biggest inspirations because she also can't feel her legs and she does every single thing. And I never knew if I would be able to do it because I like these things because I didn't feel my legs. And her name's Victoria Arlen. I don't know if you've ever heard of her, but she was, I mean, she was on Dancing with the Stars, dancing
All
in
right.
high heels, and she can't feel her legs. And
It's crazy.
Wow.
like, if there's one person that's my inspiration, like, forget like the people that support, because there's just too many. Like, I can't pick one person. I mean, I didn't even mention all my friends, like
You feel guilty.
Lauren
Yeah.
and all these people, Kat, all these people. I can't name all them. There's too many.
Sorry, friends.
I know. There's just, I can't. I'm gonna forget
They're not
to
gonna
name
be
people,
upset.
and it's gonna just. They're all.
I
Special.
put you on the spot. Blame me.
But
Bad
my
Ryan.
one, so I'll change it, and I'll say my one main inspiration. And I've never met her. I hope to meet her one day. I mean,
Maybe she sees this podcast.
Maybe she will.
She
And
sees it, you never know.
We'll tag her.
She is just, for me, I listen to her speak and I watch her. She's on ESPN and I watch her doing all these amazing things. She's had setbacks. I've had setbacks. And she's come back just even stronger. I've come back even stronger. I look at her and I'm just like, wow,
Someone
like
to
if she
relate
can
to.
do it, I can do it. She can't feel her legs and she's walking and she's running and she was in the Paralympics and she does on Dancing with the Stars. And I mean, I was not a good dancer before. I'm not a good dancer now, but I'm not going on Dancing with the Stars.
Maybe you could. You never know.
But like you just see this and it's just, it makes it real, right? It makes it seem like I can do it. And I've looked up to her since.
Just like you two are sitting here tonight telling your story, making it real for that child that's sitting in Children's Specialized Hospital or a hospital anywhere in this country. I'm going to cut you guys off.
Yeah, it's okay. It's cold.
This is, I know you're freezing over there. We had to let the fire burn down so it wasn't blowing in your eyes. You girls are amazing. You're going to do amazing things. And I'm so grateful that you were able to come share your story on Fireside America. And I know for a fact you guys are going to get a ton of positive feedback. So thank you.
Well,
Thank you for having us.
Yeah,
You're
thank
very
you.
welcome.
Thanks for giving us this space to, share our story, but also inspire these other kids
guys
and
inspire
help them.
me.
Help them. Thank you. You inspire us. I
Yeah.
mean, look, your story is nothing short of incredible. Also,
It ain't nothing like yours.
And I can't do finance, so
You will one day. Thank you, girls.
thank you.